The whole time you are in nursing school, you look forward to graduating and becoming a licensed nurse. After NCLEX-RN, what next? Here are 12 things you can do after passing the NCLEX-RN. 1. Take a day or two to relax and recharge your body and mind. You have spent a great deal of time studying and working to achieve the goal of becoming a registered nurse. After passing NCLEX-RN, you deserve a break. That is not to say you should take months off work or go on a cross-country trip. You can take a few days to unwind and let your body and mind rest. Sleep late, stay in your pajamas all weekend, eat the chocolate cake, or take a bubble bath. Whatever makes you feel relaxed, do it. 2. Think about the setting or care environment where you would like to work. One of the great things about nursing is there is a wide range of environments to find a job. A few options include hospitals, nursing homes, and assisted living facilities. Some nurses prefer primary care, while others like acute or critical care. 3. Consider a specialty. Not all registered nurses choose a specialty. However, if you have a preference to work with a particular patient population or in a specific environment, you could choose to earn a specialty certification in that area. It is often easier for new nursing graduates to find their place in specialties like Med-Surg. But that does not mean you will not be able to work in another specialty. Keep in mind, if you do not get to start in the specialty that interests you most, it isn't the end of the world. Get some experience and try again. 4. Consider getting involved in a nurse residency program. After you graduate and find out you passed NCLEX-RN, you are free to begin work as a registered nurse. While you can apply for jobs and go to work without any other training, some new nurses enjoy the benefits of a nurse residency program. These programs are a formalized entry into nursing practice that includes hands-on and classroom learning based on professional and clinical topics. Nurse residency programs are usually offered by hospitals systems or larger healthcare organizations. They can last from a few months to a year. Again, a nurse residency program is not required, but it is an excellent way to get additional training and experience while earning an income. 5. Find a mentor and ask to shadow them. Many hospitals and other healthcare facilities offer newly licensed nurses the opportunity to shadow experienced nurses while preparing to work independently. If you are job seeking and have not found the perfect place yet, you could benefit from a mentorship, even if it is short-term. 6. Update your resume. Anyone can fill out an application and submit it. Taking the time to prepare a professional resume allows you to include information about yourself and your experience a generic application may not request. Be sure your contact information, including your email and phone number, is correct. Include any certifications you earned while in school, including IV therapy certification and CPR. 7. Request letters of professional recommendation. Although job applications have a place to list work experience and personal references, you should go a step further by getting professional letters of recommendation. If you have work experience in any healthcare setting, ask your previous supervisor to write a letter for you. Nursing instructors are also good sources for letters. Those who prepare letters for you should be able to speak to the likelihood of your success as a nurse. Be sure the person's contact information and credentials are included in the letter. You can ask for general letters of recommendation which speak to your skills, personality, and anything else the writer feels is pertinent to your professional success. Targeted or specific letters of recommendation are letters that are written with a targeted employer in mind. For instance, if you want to apply to work in a hospital's labor and delivery unit, the nursing instructor who taught you OB could write a letter that details your clinical experiences in labor and delivery. 8. Get copies of your nursing transcript. Not all employers ask for your school transcript. Then again, some do. Like letters of recommendation, it is always best to have your transcript on hand if you are asked for it instead of making a prospective employer wait for you to get a copy and return it to them. Being prepared with documents ahead of time shows you can take the initiative to get things done without being asked, which is a good characteristic of any nurse. 9. Network with other nurses. One of the best ways to get exposure as a new nurse is to network with other nurses. If you have a social media account, look for the social media pages for local nurse organizations and healthcare facilities. Like and follow those pages. Many of them have member questionnaires you can fill out to let others know more about you. Networking with other nurses after passing NCLEX-RN can help you get recognized and may make job seeking easier. 10. Utilize the network you developed in nursing school. In addition to joining local nursing organizations and networking with other nurses, take advantage of the contacts you made while still a nursing student. Talk to directors of nursing or hiring managers at some of your previous clinical sites and find out if they are hiring. Facilities that accept nursing students for clinicals get an up-close look at future nursing candidates, and there is a good chance you may have already been recognized as a potential employee. You won't know for sure until you ask. 11. Start applying for jobs. If you have taken and passed the NCLEX-RN, start applying for jobs. Many healthcare facilities will post entry-level nursing positions while others simply have openings for registered nurses. When you apply, verify the requirements candidates must meet. If you are interested in a position not listed as an entry-level position, you can still apply. Always follow up your application with a phone call to the Human Resources Department to verify if the job is still available and ask for an interview. Lack of work experience does not automatically disqualify new nurses from a position, but you will not know unless you ask. 12. Never stop learning. The healthcare industry is constantly changing and evolving. Successful nurses acknowledge the need for continued education and take the initiative to learn new tasks and methods of practice. Whether you decide to pursue a higher degree or want to be the best nurse you can be in the position where you are employed, there is always something new to learn in nursing.